I feel good when the patients are happy that I've answered their questions. Sometimes I've given them answers they didn't want to have, but at least they feel that they're moving forward in taking care of their problem. I like the science of medicine, but I also like the interaction with people. And it's fun to talk with them, and especially when people come back and you get to know them over a period of years. You begin to know their spouses, their children. And the bottom line is that we want to make sure that the patients are taken care of appropriately. When the patient comes to visit me, I'm the one who's responsible. And therefore, I want to make sure things are done correctly because I am responsible. There's a lot of patient fears about medicine. Even as myself as a patient, I sometimes avoid getting a blood test done because I'm worried that what it's going to show. And even though I chide my patients on doing that, I realize that that's a very human thing. I think people are almost always afraid of cancer. And especially in my field, I try to let them walk out of the office knowing that even if they haven't told me they're afraid of cancer, that this isn't about cancer at all. And sometimes they come for some condition that has nothing to do with cancer, but I know that they're thinking that. And I think it's important to do that. We work very hard with the primary care doctors and other physicians outside of PMA and have, in several of them, established computer links to help speed up the referral process and define what the problems are. In my field, the two biggest aspects of prevention are in the fields of heartburn and reflux of acid and preventing cancer by medications and determining if people are predisposed to cancer. And the second one is, which is a major thrust in this country, is to prevent the prevention of colon cancer with screening colonoscopies, which our group has been committed to. We have not only have the endoscopy suite where we do this and get patients in quickly, but we make every effort to let all of our patients know that anyone over the age of 50 needs to have this done. I think that makes a difference.